Assalamualaikum and greetings everyone. My name is PUTRI NURATHIRAH binti HIRMIZALI, and today I would love to talk about the field that I'm interested in, which is cardiology. The content that I'm going to present today is the introductions of cardiology, cardiologist, anatomy of heart, physiology of heart, disease related to cardiovascular system, and the treatment applied. To start off, what is cardiology? The word cardiology comes from an ancient Greek which is cardia means heart and logia means study. So cardiology is a branch of medicine that study the heart and blood vessels as well as the diseases and disorders that affect them. And what is cardiologist? Cardiologist is a medical doctor who specializes in diagnosing, treating, and preventing diseases and conditions of the heart and blood vessels, which is our cardiovascular system. There are two subdivisions in the field of cardiology, which is invasive cardiology and non-invasive cardiology. Invasive cardiology, they perform various procedures such as heart catheterization, permanent pacemaker insertions, and electrophysiology. Meanwhile, non-invasive cardiology focus on the management or prevention of cardiovascular diseases. Next, I will talk about one of the cardiologists in Malaysia, which is Datuk Seri Dr. Balachandran Kandasamy. He is a consultant cardiologist. His qualification in MBBS, Diploma in Cardiology, MRCP at Ireland, FRCP and FAPSIC at Asia Pacific. His medical school is at University of Delhi, India, University of London Imperial College and Royal College of Physicians of Ireland, Dublin. For membership and association, he is a Fellow in Asian Pacific Society of Interventional Cardiology, Fellow at Royal College of Physicians of Ireland. He has full registrations in Malaysia Medical Council and Malaysia Medical Association, also a specialist in cardiology in National Specialist Register Malaysia, and not only that, he is also a member in European Society of Cardiology. Throughout his career life, there are several conditions that he has treated, which is cardiac emergency, hypertension, acute coronary syndrome, coronary artery diseases, and renal denervations. And the procedure that he has performed is cardiac catheterizations and coronary angiogram, percutaneous coronary interventions, rotational atherectomy, orbital atherectomy, IVUS, FFR, OCT, and echo or 2D study. And he has been awarded for Darjah Datuk Setia di Raja Kedah, Darjah Seri Mahkota Wilayah, and Darjah Gemilang Pangkuan Negeri. Moving on to the anatomy of heart, now we're going to see the locations of our heart. Our heart is approximately the size of our fist and it is located at the superior surface of the diaphragm, slightly left to the midline of our body, anterior to the vertebral column and posterior to the sternum. And as you can see here, the heart is considered as a trapezoidal shape. Next, I would show you the clear picture of our heart borders. There are four borders of our heart, which is the superior border, right border, left border, and inferior border. And the apex of our heart is located at the fifth left intercostal space in the mid-clavicular line. Now we're going to see the anatomy of heart at the anterior view. So as you can see, our heart is attached to the three great vessels, which is superior vena cava, aorta, and also pulmonary trunk. So here is the right auricle of our heart, and this is the left auricle of our heart, and there are four chambers and valves in our heart. Next, we're going to see the chambers and valves in our heart. To start, we're going to see the right atrium, which receives the blood from our body through three veins, which is SVC, IVC, and coronary sinus. The posterior wall of atrium is smooth, meanwhile the anterior wall is rough because of the presence of pectinate muscle, which also extend to the auricle. Between right atrium and left atrium, there are a thin partition called interior septum, and the blood passes from the right atrium into the right ventricle through a valve called tricuspid valve. Next, we're going to see the right ventricle. The right ventricle contains bundles of cardiac muscle fibers called trabeculae carneae. The right ventricle is separated from the left ventricle by a partition called interventricular septum. And the blood passes from the right ventricle into the pulmonary trunk through a valve called pulmonary valve. Moving on to the left side of our heart, you're going to see the left atrium where it receives blood from the lung through pulmonary vein. Both of the wall is smooth because the pectinate muscle are confined to the auricle of the left atrium, and the blood passes from the left atrium to the left ventricle through a valve called bicuspid or mitral valve. Moving on to the left ventricle, where blood passes from the left ventricle into the ascending aorta through aortic valve. Some blood in the aorta flows into the coronary artery, which branch from the ascending aorta and carry blood into the heart wall. And if you can see, there's a remnant here, which is the ductus arteriosus. It closed shortly after birth, and it is called ligamentum arteriosum. Next is the physiology of our heart. The deoxygenated blood will goes into the right atrium through SVC, IVC, and coronary sinus. Meanwhile, the oxygenated blood will goes into the right atrium through pulmonary veins. And then the sinoatrial nodes or SA node at the right atrium will generate electrical impulse which act as the natural pacemaker. The signal then spread through the walls of both atria and causing them to contract and push blood into the ventricles, and then the electrical impulse will reach the atrioventricular nodes or AV node at the junction of atria and ventricle. Then the AV node briefly delays the signal. Why? Because it wants to allow the ventricle to fill completely with blood. And then the electrical signals then will travel through the bundles of His, and then it splits into right and left bundle and reach the Purkinje fibers, which spreads throughout the ventricular walls. This then causes the ventricle to contract forcefully and allows the blood to go into the pulmonary trunk and also aorta. Next, I will talk about one of the diseases that related to our cardiovascular system, which is acute myocardial infarction. AMI, or commonly known as heart attack, occur when there is a blockage in one of the blood vessels that supplies our heart. For example, here, there is a plaque built up on the artery's wall. A plaque is a sticky substance that made of fat, cholesterol, and other substance. The plaque deposits inside the coronary artery can break open or rupture, which triggers platelet aggregation, then forming a blood clot. This will reduce blood flow to a portions of our heart and then cause lack of oxygen and then affect our heart muscle. Without oxygen and nutrient, our heart muscle will begin to die. Next, I will talk about the factor of AMI, sign and symptom, and also diagnosis and test. For the factor, there are several here, which is sex, age, family history, smoking, diabetes mellitus, hypertension, obesity, and also drug use, for example, cocaine. And for the sign and symptom, chest pain or angina, shortness of breath and trouble breathing, trouble sleeping, nausea or stomach discomfort, and also feeling lightheaded or dizzy or passing out. For the diagnosis and test, firstly, we can do blood tests to check for cardiac troponin in blood, because damage to heart muscle cells always causes this chemical marker to appear in bloodstream. Secondly, we can do electrocardiogram. This will help us to see if there is any abnormalities of the rhythm of our hearts. Thirdly, we can do echocardiogram, where it generates pictures inside and outside of the heart. This can show how well our heart is squeezing and how well the valves is working. Next, we can do coronary angiogram, which use X-ray and contrast dye to show the blood vessels to determine is there any blockage. And then lastly, we can do CT scans of our heart, where it creates high detail scans of our heart and blood vessel to show if there is any significant narrowing or hardening of the major coronary artery. For example, here you can see in the picture that I've provided, there is a narrowing at this part of the blood vessels. Lastly, I will talk about the treatment for AMI. So there are few part of this, which is pre-hospital care, where we can use oxygen, aspirin, nitrates, and triage to an appropriate medical center. Secondly is the pharmacologic therapy. We can use antiplatelet agent, for example, aspirin and clopidogrel, and then anti-anginal therapy, which is nitroglycerin to reduce the chest pain, and then anticoagulant, for example, A. Heparin, and B. Valirudin, and then beta blocker to reduce heart rate, atrial pressure, cardiac workload, and oxygen demand. Third one is reperfusion therapy. We can use fibrinolytics or angiography with percutaneous coronary interventions or coronary artery bypass surgery. And for rehabilitations and post-discharge treatment, the patient must change their lifestyle to more regular exercise, diet modification, weight loss, and smoking cessations, and also they need to continue their medications. I think that's all from me. Thank you.